Welcome to the Collaborative Resource Hub by Wellness Provisions. I'm Amy McBride, owner of Wellness Provisions, the most badass wellness business. You're tuning in to the Delay Dying Blog podcast edition because who wants to read when you can have someone read to you? Unless you like using your eyeballs, then catch every single essay over on the website. Just select ones, make it to the podcast. And if you're the pill popping type, no supplements, then Welly P has you covered. We supply rock and rollers with high quality supplements. We're a trustworthy place to go where you can essentially shop blindfolded. Last but not least, my legal disclaimer: nothing in this essay or the Collaborative Resource Hub substitutes medical advice. Please connect with your GP if you need medical guidance. These are my essays, my take on all things wellness, written to educate and inspire. Enjoy today's essay. Brush your teeth or die. Okay, yes, that might be a little excessive, but on the other hand, it's also kind of true. So, unless you want to get sick and die from not brushing your teeth for 2 minutes twice a day, then I suggest you continue listening. Your oral health, meaning the state of your teeth and gums, represents the health of your overall body. In other words, an unhealthy mouth can indicate issues in other areas of your body. In this essay, we're going to explore why 2 minutes of brushing is recommended, as well as how oral health relates to cardiovascular disease and diabetes and can cause premature births in pregnant mamas. So, put that soda in the trash, drink some water, and chew some xylitol gum. Yeah, xylitol-based products have been shown to inhibit the growth of bacteria in the mouth, and it doubles as a healthy sugar substitute. So swap your gum or mint to a xylitol version, and it's a win-win. Cavities in under 2 minutes. Duh, if you don't brush your teeth, you're going to get cavities, and then your teeth are going to rot, abscess, and fall out. And the tooth fairy won't be there waiting to collect those little gems in exchange for a shiny quarter. Nope, you'll be penniless and toothless. But then I guess you wouldn't need to worry about brushing your teeth anymore, so there's that. But how will you chew your food? I guess it'll be smoothies for you then. But hang on, let's rewind. Let's go back to your bathroom sink where your untouched dental floss, toothbrush, and toothpaste reside. Do you really need to brush your teeth twice a day for 2 minutes? Well, to quote Self, according to a meta-analysis published in the Journal of Dental Research, they found that brushing fewer than 2 minutes a day was consistently associated with more tooth decay, aka cavities, than brushing twice a day or more. Tooth decay happens thanks to plaque, a sticky bacteria-laden film. These bacteria produce acid that eats away at your enamel, the hard outer covering on your teeth. They can also damage your gums and cause gingivitis, the first step in gum disease. It was also uncovered that brushing your teeth for 2 minutes leads to a far greater reduction in plaque than brushing for 1 minute. A 2012 meta-analysis found that on average, people who brushed for 1 minute removed about 27% of plaque. When people brushed for 2 minutes, they removed around 41% of the plaque on their teeth, almost twice as much. Boom, research prevails, brush your teeth, or else. Diabetes and cardiovascular disease. According to the American Dental Association, people with diabetes, especially uncontrolled diabetes, have more gum disease than those without diabetes. Scientists are finding that gum disease may raise blood sugar levels in people with and without diabetes. It's been found that those who have severe gum disease have chronically high blood sugar levels, which of course can open the floodgate for type 2 diabetes as well as heart disease. Infection causes inflammation. Inflammation can become systemic, meaning it no longer sets up camp locally, but instead decides to conquer your entire body. So systemic inflammation can cause all the chemical reactions we rely on day in and day out to go haywire, and levels go up where they shouldn't. And remember too, inflammation, and in this case, tooth decay and gum disease, is inflamed, no pun intended, by sugar. Sugar rots your teeth and causes inflammation. Harvard Health even backs that up, saying consuming too much added sugar can raise blood pressure and increase chronic inflammation, both of which are pathological pathways to heart disease. And here we've been led to believe it's all other foods that cause heart disease. Pish posh, it's sugar. Well, and hydrogenated oils and vegetable oils that oxidize. And anyway, I'm going on a tangent here. Back to gum disease and blood sugar levels. If you're wondering how exactly gum disease affects blood sugar levels, well, I'll tell you. The American Dental Association says that scientists think that some of the germs in infected gums leak into the bloodstream after normal activities, such as chewing or toothbrushing. This starts a reaction from your body's defense system, which in turn produces some more powerful molecules that have harmful effects all over your body. An example is raising blood sugar level. I'd also like to add real quick that if you currently have diabetes, keeping your mouth healthy is of the utmost importance as it can keep your overall health more balanced. Now, what happens if a pregnant mama who is constantly craving and inhaling pickles and ice cream doesn't brush her teeth? Instant gratification with long-term side effects. That's what. Premature births in pregnant women. So I'm going to pull a chunk of information from the Wisconsin Department of Health because they nailed it. What you really don't even want nailed, they did it. So check this out. It's nuts. There's now evidence suggesting that oral health, particularly gum disease, may have an impact on the occurrence of preterm births, resulting in low birth weight babies. Pregnant women with periodontal gum disease may be 7 times more likely to have a baby that's born too early and too small. The exact connection between poor oral health and preterm birth is unknown. It's thought that periodontal disease may lead to premature birth by the bacteria in the mouth spreading to the placenta or amniotic fluid, and also that systemic inflammation caused by periodontitis may lead to preterm labor and membrane rupture. The likely problem is a chemical found in oral bacteria called prostaglandin, which can induce labor and which occurs in very high levels in severe cases of periodontal disease. So, what's a pregnant mama to do with those pickle and ice cream cravings? Well, try taking a maitake mushroom supplement, which is safe during pregnancy and used to balance blood sugar levels. Also, make sure to brush your teeth, floss, chew some xylitol gum, drink water, and check in with your dentist during your pregnancy. Now, if you liked having some proactive tips and you're not pregnant, what are some other things you can do to maintain oral health? Supplements such as vitamin C to promote healthy immune response and promote collagen production, and minerals taken to keep your teeth strong, as well as vitamin D, which is key for mineralization in teeth. Using mouthwash, preferably a natural one without food coloring or artificial sweeteners, and that does contain xylitol for its bacteria fighting properties. Using a copper tongue scraper to reduce bacteria in the mouth and also improve immunity and sense of taste, brushing and flossing, obviously, and yearly dental cleanings. Keep things on the up and up. Okay, so how excited are you to brush your teeth like a zealous dentist? Good, then my job here is done. If you're in need of any motivational support or accountability buddy stuff on your journey towards being the most badass version of yourself there is with amazing oral hygiene, then hit me up. As a wellness coach, I can help you curb your negative self-talk by reciting positive affirmations in the bathroom mirror while you're brushing your teeth. Over and out. Amy McBride, Wellness Provisions.
My life was a mess until I met